University. I am majoring in athletic training with a concentration in applied medicine and rehab, and I'm also minoring in massage therapy. So this video is being made of spring of 2020 for PE 483, and this whole workout is going to consist of exercises and workouts specifically for pregnant women in their third trimester getting ready for labor and delivery. Alright, so this is my sister-in-law Stacy.
Hello.
She is currently 37 weeks pregnant and nearing the end of her pregnancy. And so this is who is going to be completing the workout and the exercises that I have put together for her. Throughout her pregnancy, she has been pretty unactive, just going on like a few walks throughout the week, pretty minimal and basic. And so we're going to make sure that the workouts she's doing is based around that and based around her activity level. So Stacy is currently 37 weeks pregnant, and because of that, she's pretty far into her pregnancy, and we're going to make sure that we really try to avoid high impact activities such as bouncing, jumping, those types of things. So a lot of the exercises are going to be very low expenditure energy, very minimalistic and basic. And all the exercises that we're going to do are going to be completed outside, and since we are currently in the midst of quarantine, a lot of the exercises are going to be creative, and we're going to use what we have around the house. So some of the equipment we're going to use is going to be a chair. We're going to use a beach mat instead of a yoga mat because we don't have a yoga mat with us right now. And then we're also going to replace some light weights with baby bottles because every expecting mother has baby bottles that she can have access to. And we're also going to use a small ball, either like a tennis ball, baseball, something along those lines for a balance activity. And we're also going to use a foam roller for stretching and getting her muscles loosened. So for a warm-up, Stacy is going to be stretching for about 5 minutes. And when she's stretching, we're going to make sure that we're very, very cautious and aware of how she's feeling, because during pregnancy, the hormone known as relaxin is known to increase dramatically. And so because of that, this hormone is used, especially during labor. It helps the muscles relax, and a lot of the muscles used during delivery to stretch and all the things necessary to have a baby. And so because of that, we're going to make sure that we're not stretching her too much. This hormone allows her to overstretch, and so we're going to be very, very cautious when doing that. For the first stretch, we're going to do a simple low back stretch. Stacy is going to do 10 repetitions of this stretch. She will start on her hands and knees and pull in her stomach, rounding her back slightly. She will hold this position for 3 seconds and then relax. This is going to help her stretch her low back, which will help ease with backaches, which are very common throughout pregnancy. So the second stretch we'll be doing is the seated piriformis stretch. A lot of times this stretch is completed on the ground, but during pregnancy it is a lot easier to do this stretch while using a chair. And so the piriformis is a muscle that is known to spasm a lot during pregnancy and often is the cause of back and leg pain due to its relationship with the sciatic nerve. To avoid this, Stacy's gonna do this piriformis stretch. And so to start, Stacy will have both feet flat on the floor. She will then bring up one ankle and place it on the opposite thigh. She will sit up straight and flex the foot that is on the thigh, and she's going to do this stretch for 2 repetitions of 15 seconds on each side. The third stretch we're going to do is the simple butterfly stretch. So this stretch is actually going to be used to help open up Stacy's hips while also stretching the inner thighs. And so Stacy's going to let her knees fall to a comfortable position where she can feel a slight stretch in her inner thighs. And she's going to hold this position for 15 seconds. And then in order to get a better stretch, she will then pull her feet in a little closer to her body for another 15 seconds. The last stretch we're going to do is a simple lunge. This will stretch some of the hip flexors, which are often pretty tight during pregnancy due to the changes of the pelvis position. To start this stretch, Stacy is going to do a lunge, and when she does this lunge, she's going to lean forward a little bit and rotate to the side of the front leg until she feels a pretty comfortable stretch. She's going to hold this for 15 seconds on each side and do 2 repetitions. So in order to get her arms stretched and warmed up, Stacy is going to do arm circles for 20 seconds forward and then 20 seconds backwards as well. It's important to start with small circles and work your way up to bigger circles to prevent injury. The first exercise I have Stacy doing is a nice 5-minute walk. We used the Borg scale, which is also known as the RPE scale, to measure the intensity that Stacy was walking at. So this scale goes from 6 to 20, and it's used to correlate with heart rate. So 6 being the very easiest and 20 being this is my absolute max, I cannot go any farther. Stacy told me throughout her walk where she was at, and that gave me a good representation of her heart rate. So say Stacy said her RPE was 6, that meant that the exercise was very easy and that her heart rate should measure out to about 60 beats per minute. So studies actually suggest that a pregnant woman's heart rate should not be higher than 140 beats per minute, which would end up equating to a level 14 on the RPE scale. Because her heart rate should not be higher than 140, I asked Stacy every few minutes on her walk to report her RPE to me, so that way we kept her heart rate at a good level. So walking is actually one of the most suggested exercises for women in their third trimester of pregnancy. It is such a safe exercise compared to a lot of the activities and exercises we do when we're working out. And so this is really a great option for women in the end of their pregnancy who are just looking to get a little bit active. And this also helps increase blood flow, reduce stress, and walking will also help Stacy feel a lot more in shape for delivery and labor. The next exercise I will have Stacy doing is squats. As a regression of a regular body weight squats, I will be having Stacy complete her squats while using a chair. She will be doing 3 sets of 8 for this exercise. When doing chair squats, she will perform a normal squat, touch her butt to the chair, and then come right back up. It's important to keep your feet shoulder width apart, back straight, and eyes forward. I'm going to continue checking her RPE every once in a while to make sure she is not physically exerting herself too much. Next, Stacy is going to be doing some pelvic tilts. She will be doing 15 pelvic tilts and holding each one for 10 seconds. This exercise is great for strengthening the abdominal muscles, lower back, and the pelvic floor. When doing this exercise, you really want to focus on shifting the pelvis anteriorly. You want to try and pull your belly button towards the floor and try and push your pelvis to the ceiling. The next exercise Stacy is going to be doing is bicep curls. Doing bicep curls is going to help Stacy build some upper body strength, which she's going to need to hold the baby all the time. I have her doing 2 sets of 12 repetitions for both arms. Since we're currently in the midst of quarantine and unable to go to the gym and have access to dumbbells, I have Stacy using some baby bottles, which every expecting mother has laying around their house. So when doing a bicep curl, we want to make sure that she is going through the full range of motion and keeping good posture. next, Stacy is going to be doing a balance exercise. In order to help strengthen her balance, we're going to have her stand on one foot and toss a ball back and forth. She's going to do 2 sets of 5 tosses on each leg. So many pregnant women often feel off balance throughout their pregnancy. A lot of times this is due to the extra weight, and they're unfamiliar with how to handle that extra weight that they have on them. And so a lot of times they're often scared of falling due to this off balance feeling, and kind of scared to harm the baby. And so in order to help Stacy feel more comfortable during this exercise and more confident, we placed her next to a wall in case she needs that extra stability. Next, Stacy is completing some Kegel exercises. So Kegel exercises are a form of pelvic floor exercises which require the squeezing and relaxing of the muscles in the pelvic floor and the genital area. So these exercises help strengthen the muscles that support the organs in the pelvic area and also help increase bladder control. So Stacy is going to start by sitting down. From the viewer's perception, it may not appear that she is doing anything, but she is actually tightening those muscles for 3 seconds and then relaxing. And she is doing that for 10 repetitions. So a Kegel exercise should actually feel like you are pretending you have to urinate and holding it in. Lastly, I have Stacy completing another upper body exercise. So she is doing 3 sets of 8 repetitions of incline push-ups. So an incline push-up is a regression of a normal push-up. It is making it easier for her by taking some of that body weight off and reducing the weight on the shoulders. So when she's doing her push-ups, I'm making sure that her body is straight and that she's going through a full range of motion. So to start the cool down section of the workout, Stacy is going to start with a nice and easy walk. We're going to do a 2-minute walk, and I want her pace to be a lot slower this time than it was for her 5-minute walk during the workout. So I really want this to be a nice and easy, relaxing walk to make sure we're slowing everything down and cooling down her muscles and helping her relax after this workout. We're going to end the whole workout with some stretching and foam rolling to help prevent any extreme muscle soreness. And the first area we're going to foam roll is the hamstrings. So when foam rolling the hamstrings, you really want to start below the glutes and work your way down and roll up and down for about 30 seconds. Next, I have Stacy foam rolling her calves, and she's going to start below the knee and go down to the ankle and roll back and forth. She's going to do this for about 30 seconds as well. Next, we're going to move to the IT band, which runs along the lateral side of each of your thighs from the iliac crest all the way down to the tibia. So this is often a very, very tight muscle, so keep in mind that it will be pretty sensitive to roll out. Stacy is going to do 15 seconds on the right side and then 15 seconds on the left side as well. The last area we're going to foam roll is the glutes. In order to roll out this area, it's a lot more beneficial to do one side at a time by crossing one leg over the other, as you can see Stacy is doing. And so she is doing 15 seconds on each side. This is a great foam rolling technique, especially for pregnant women, since the piriformis muscle is often the root of their low back pain. Next, we're going to stretch the triceps with the overhead tricep stretch. When doing this, you want to bring one hand behind your neck and the opposite hand on the elbow. She will hold this stretch for 15 seconds on each side. The last stretch we're going to do will require the assistance of a wall or something along those lines. And so this is going to be used to stretch the biceps and the chest. Stacy will put one arm behind her using the wall to feel the stretch. The higher up she would go, the more of a stretch she'll feel, and she is doing 15 seconds on each side. Was really geared towards women who are in the end of their third trimester, who are really getting ready for labor and delivery, but it's important to keep in mind that a lot of these stretches and exercises can be beneficial for people of all ages and of any activity level. So this workout really included a lot of exercises and stretches that help assist with future delivery and labor. It's really clear that pregnancy is very exhausting and tiring, and working out may not come easy to those who are pregnant, but it's very important to keep in mind that exercises like these do help prepare women who are getting ready to deliver and all that stuff. So I highly encourage being physically active throughout pregnancy, but also being very smart and listening to your doctor's instructions and being cautious while working out when pregnancy. Anyways, I hope you guys enjoyed this video, and I hope you guys can apply this to some time in your life. Thank you.